This is Paid Feeding Assistant Training Course video number 4. It's going to go over safety, emergency procedures, the Heimlich maneuver, and infection control. So the first thing I want to talk about is safety and emergency procedures. So identifying situations which call for emergency action. So the first one we're going to talk about is a fire. So the major causes of fire include improper use of smoking materials, defects in the heating system, improper trash removal, and misuse of electrical equipment. So the actions that we take when there is a fire is the acronym RACE. And on all of your employee badges, you should also have this listed out. And RACE stands for Rescue, Alarm, Contain, and Extinguish. So we want to remove the residents that are in immediate danger. Rescue, remove. So that's number 1. Anytime there's a fire, the first thing we do is get the resident out of that room. Second thing we want to do is alert other staff. We want to pull the alarm so that we can let everybody know that there is a fire. The third thing we want to do is contain the fire. So we want to close doors, get behind fire-rated doors, keep it contained so that it's not going to grow and get bigger, and then extinguish the fire if possible. And if we can't extinguish, then we're going to evacuate. We always want to follow the procedures of the facility. So we have quarterly fire drills for that reason, to make sure everybody knows what they're supposed to do in case of a fire. So use of a fire extinguisher. So most fire extinguishers are the dry chemical type, suitable for all types of fires. So if you ever need to use a fire extinguisher, you want to remember the acronym PASS. So the first thing you do is you pull the pin located up near the squeeze handle. You have to twist and pull it. You want to aim the nozzle at the base of the fire. If you aim it at the top, the tips of the fire, it's not going to do anything. You have to really get to the center, the main part of the base of the fire. You want to squeeze the trigger handle and then sweep back and forth, side to side at the base of the fire to try to put it out. Another safety emergency situation that could occur would be choking. And this is more likely fear for someone who is a paid feeding assistant, is if someone starts choking. So choking is the hindrance of breathing due to an obstruction of the throat or the windpipe. And it's actually fairly common. Choking deaths commonly occur in children less than 3 and in senior citizens, but they can occur at any age. So the Heimlich maneuver has been valuable in saving lives and can be administered by anyone who has learned the technique. So we're going to talk about that technique now. So clearing an obstructed airway. If the resident is coughing but is able to breathe, we do not do the Heimlich maneuver. That person is still attempting to clear their own airway. If they're coughing, then that means that they're the best shot that they have of getting whatever is lodged in there out is going to be their own body coughing it out. We do not want to intervene. Once they are no longer coughing and they're silent and they're doing the traditional signal that they are choking, that is when we would intervene. So clutching the neck, just like this man is doing here. This is the international symbol for I am choking. Humans instinctually do this when they are choking. Doesn't matter what age they are, gender, cultural background, it's a human behavior. So someone who's choking will do this universal sign where they take both hands and put them near their neck. If someone is doing this, we would want to first ask them if they're choking. If they can't answer us, we need to come up and determine if they can cough or speak. If they're not coughing or speaking, they're doing that universal symbol and we think they're choking, we're going to stand behind the victim, wrap your arms around the victim's waist, just like this person's doing here. This hand here makes a fist, and then on the other, your other hand's going to go right over top of that. You place the thumb side of the fist against the abdomen, the fist in the middle above the navel and below the end of the sternum. You grasp your fist with your other hand, press your fist and hand into the victim's abdomen with a quick upward thrust. So you're going to have your fist, this is covering it, the thumb is right here, and we're going to push up, 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 over and over again until we get this person's airway cleared. So we're going to do that until the object has been expelled or the victim loses consciousness. So while you're doing this, you're also going to be yelling out for help if you're for some reason by yourself, to get someone in there to assist you. If the person loses consciousness, we would then start CPR, which you are not required to do. But if it gets to this point, we would want someone else there to assist us. Anytime the Heimlich maneuver is used on a resident, or a resident demonstrates choking symptoms, we need to let the licensed facility staff know, because the Heimlich maneuver, almost always when you're doing it, is going to make someone throw up. So we're basically pushing on them right in their abdomen, so it's very likely that they'll also throw up. And then we've also done a trauma, right? Because we're taking our fist and pushing it very hard into their abdomen. So we need them to be checked out by a nurse. And then we also just, if they were choking, we need to make sure that they didn't aspirate, there's nothing else that got in. So they really need to be checked out by a licensed facility member. The next big section I want to talk about is infection control. Now more than ever, we are talking about hand hygiene. We're talking about making sure that we're doing clean technique as best we can because of what's going on with COVID-19. But infection control is always important. Older people have a hard time fighting infections. So it's our job as health team professionals to prevent the spread of infection. Microbes are germs that cause infection. They're too small to be seen without a microscope. Microbes are everywhere. Microbes can enter the body through equipment used in treatments, therapies, and tests. Staff can transfer microbes from one person to another and from themselves to other people. Asepsis means being free of disease-causing microbes. Aseptic practices break the chain of infection. So to prevent the spread of microbes, wash your hands. The number one thing that you can do to prevent a resident from getting sick is wash your hands. So we want to wash our hands after we use the restroom, after we have contact with your own or another person's bodily fluids or secretions, after coughing, sneezing, or blowing our nose, before and after handling, preparing, or eating food. And it's not on here, but also if you smoke, you want to wash your hands after you smoke as well. We want to also do the following. So provide every resident with their own eating utensils. Nothing is shared from resident to resident that goes in their mouth or in any infection control related area. So own their own eating utensils, their own drinking glasses, their own toothbrush, all of their own personal care items. We can't cross back and forth between different residents because it's an infection control risk. You want to cover your nose and mouth when coughing, sneezing, or blowing your nose. So just like this little guy down here, this little vampire, I was always taught to, whenever you sneeze into the crook of your arm, like the little vampire, cover your face. Then we want to make sure we wash fruits and raw vegetables before eating or serving them. So hand washing. Hand hygiene with soap and water is the easiest and the most important way to prevent the spread of infection. Your hands are used for almost everything, and they're extremely easy to contaminate. Your hands can spread microbes if hand hygiene is not practiced before and after giving care. So the hand washing procedure. You want to make sure you have soap, paper towels, and a wastebasket. Stand away from the sink so your clothes do not touch the sink. Make sure you can reach the soap and the faucet. You want to turn on and adjust the water to warm temperature. Wet your wrists and hands under the running water and keep your hands lower than your elbows. You're going to apply about a teaspoon of soap to your hands. Rub your palms together and interlace your fingers to work up a good lather. This step should last about 20 seconds. You may have also heard 2 happy birthdays. Wash each hand and wrist thoroughly. You want to clean between the fingers, clean under the fingernails by rubbing your fingertips against your palms. Rinse and dry your hands and wrists with a paper towel. Pat them dry, starting with the fingertips and working your way up to the part where you stopped cleaning. And then discard the paper towels. You want to turn off the faucet with a clean paper towel so that you're not recontaminating your hands. That's probably the biggest mistake I see people make is they go through all this effort, they wash their hands, they do such a good job, and then they just take their nice new clean hands and touch the filthy faucet handle that you touched before you ever even started the process. So you just recontaminated your hands. So always turn it off with a clean paper towel. Hand maintenance. Fingernails should be short and clean. Nail polish, artificial fingernails, acrylic nails, it's hard to keep them clean and they can break off into food. So they should not be worn while handling food. Cuts and sores on the hand, hangnails should be treated, kept covered with clean bandages. If hands are bandaged, clean, form-fitted gloves should be worn at all times to protect the bandage and to prevent it from falling off. That gets us to glove usage. Gloves must never be used in place of hand washing. So hands must be washed before putting on gloves and after removing gloves. Gloves are just a barrier for the in-between, but we need to make sure they're clean before and after the glove usage. Gloves used to handle food are for single use only and should never be washed and reused. If you're ever assisting more than one person at a time, you need to make sure that you're not cross-contaminating. You're not using your gloved hand to feed more than one person. Gloves should be changed as soon as they become soiled or torn and before beginning a different task. So serving food properly. Feeding assistants will carry trays and plates, uncover food items, use silverware to prepare and feed residents, butter bread, cut up meat, those sort of things. These things must be done in a sanitary manner. Feeding assistants should strive to meet residents' needs without directly touching the food. So avoid touching food with your bare hands. Whenever possible, use utensils to cut and feed food items or wear gloves. So like if someone has a roll and it needs to be buttered, we can't just grab that roll with our bare hand. Even though we did wash our hands, we can't just grab that roll and break it in half and butter it. We need to be using a fork to hold it, cut it, and then do it that way. We don't ever touch anything with our bare hands. We don't test the temperature of the food by touching it with your fingers. Warmth of food can be tested by holding your hand or wrist over the food item without touching it. Or you can touch the bottom of the plate to sort of see how hot something is. Of course, you can check for steam. We never blow on food to cool it off because, our mouths, we could be spraying out germs from our mouth onto their food. If the food is too hot, we want to stir it to incorporate air into it and cool it off, especially food that we've reheated in the microwave. But we talked about that a little bit earlier. We typically don't do that. You may want to start with a different food. So if you got like lasagna, a salad, start with the salad so the lasagna can cool down. So that you can start with something while the hot food is cooling. Handling of utensils. So we only handle the edges of plates. You can see this picture right here. This person's doing a really good job. You want to hold the bottom and just the very barest minimum amount of your thumb holding onto that plate. We don't want our whole thumb deep into the plate. The very minimum is what we want to do. We want to handle utensils like forks and spoons by their handles only. Never grab them by the part that goes in someone's mouth. For glasses and cups, you want to handle on the side or use the cup handle. We never touch the rim. We don't carry glasses by the rim or put our fingers inside of any kind of container. And we always use serving forks and spoons to serve food.